Good afternoon. My name is Tim Killian, Killian. I'm Public Information Liaison with Care Center of Kirkland. We've been doing 1 p.m. briefings, and I said I would call you back together if there were new information to share. We have received new data. This has to do with testing. This afternoon, shortly after our 1 p.m. briefing, we received a batch of test results from the University of Washington. We received 35 total test results. That means we have about approximately 20 residents left to receive results on. But the results are as follows. Of the 35, we have 31 positive, we have 1 negative, and we have 3 inconclusive results. So again, that's 35 total tests. 31 of our residents in those tests have tested positive for the coronavirus. 3 are inconclusive, meaning they have to do further testing, and 1 result is negative. I'll take questions.
Are they all current residents? How many residents are of those?
These are residents inside the facility
right now
at this point.
So it doesn't count the ones who've already left and tested?
No. These are all test results of current residents within the facility.
Can you expand on the inconclusive test? What they have to do next? What do you know about it?
All I know is that they need to do further testing. So I don't know if that means they do a new test or they can use the swabs and the kit that they already have to do that as well.
And how many people then are not tested inside?
It's approximately 20 that we're still waiting on results.
So everybody's been tested, every resident?
Every resident has been tested within the facility.
And how about the workers?
We still have not tested the employees within the facility. We have received word that it's possible that they will be doing testing of employees off-site, but that hasn't been finalized yet.
Did they tell you what this means for you going forward in treatment?
So according to the word we have received from King County Health primarily, and I believe that they're in consultation with other agencies, is that our residents who have tested positive will remain on site. We will not be immediately transferring them to hospitals or other locations. The facility has already been working on a contingency plan. We have a smaller wing of the facility in which we'll be moving those who test negative into that space, and that work is ongoing. We have been calling families. In part, we delayed this a couple hours so that we could get as many of those family phone calls done prior to making this announcement this afternoon, and most of those phone calls have been made.
Did they offer any insight into, any insight as to why so many have tested positive? Have they learned anything new?
No, other than sharing of direct information, there's no further information they've given us.
Why won't they be hospitalized? Why are they remaining home?
As we understand, as soon as they show symptoms, as we've been treating all patients, once symptoms hit a level of acute where we feel we can no longer treat them, then we will transfer them to hospitals. But they haven't given us, we don't have an exact reason why. Our understanding, though, is that it's about space within hospitals and other constraining factors that exist in other facilities.
But it's not just symptoms. I mean, they have to be pretty severe before you move them out to a hospital, right?
Correct. Those symptoms have to reach a level of acuteness that our nursing staff feels that they would be better treated outside of here.
Any luck since 1 o'clock with trying to get tests or getting more information about testing employees?
What we're hearing now is it's potential that they will be doing off-site testing of our employees, but that has not been finalized.
With so many people testing positive inside, what precautions are keeping the employees from taking the virus outside of the facility?
As I said earlier, the employees are all trained in infectious disease. They all wear personal protection equipment. So they are following their same training in guidance with other guidelines that we've received from the CDC.
It just doesn't seem that, just kind of having seen some people outside, it doesn't seem like they're wearing the same level of protective gear that I've seen in other videos.
Some people you're seeing are administrative, and so they may be in less protective gear just in the immediate lobby there. So in part, that's what you're seeing.
So it is accurate to say that hospitals don't have enough room potentially for all of these residents?
I can't speak definitively for those hospitals, but that's our understanding, is that until they are to a level of acute symptoms that they need that hospital space, they've asked us to keep these residents in place.
Were you able to get any clarification on the discrepancy between the numbers that you had here earlier of people who had passed and the King County
No.
information that 19 of the people who had passed?
Frankly, our focus has been on receiving these test results and working with contingency plans and communicating with family members.
Will the inconclusive tests, will those patients be tested again?
I'm unaware of exactly what is required to complete that.
Is this, do you know the age range of the people inside right now?
I don't have an age range.
Okay.
I've asked that, and they are hesitant to give out demographic information at this point. I'll keep asking and see if we can get an average.
Do any have symptoms?
As of this afternoon, as I mentioned, 7 people were exhibiting symptoms under the level of acuteness that we would transfer them out, but there were 7 total this afternoon.
But with the positive test results, though?
That hasn't,
Of
those
that group with the positive?
those have all been our same residents that we've been dealing with. So I haven't correlated those 7 with the positives, but I'm sure we'll be looking to do that.
The one who was negative, there's only one, right?
Correct.
Is that resident being treated in any kind of different protocol than the ones who were sick?
As I said, we've set up a contingency plan with a smaller wing in the facility where we're going to be moving patients who test negative into that wing.
Any of the nurses travel to other life care centers such as Marysville and treated patients there?
I don't have specific information on who has transferred to different locations. We have had other nurses coming in here. Whether or not they've gone back and worked in other locations, I'm unaware. I'll follow up with that question.
Tim, just to clarify, the death numbers on the release you gave us earlier today,
Remain the same that we've had.
but just because they died in that time frame doesn't necessarily mean they died from coronavirus, right?
Correct. As I'd said earlier, in this facility we may have between 3 and 7 deaths a month. So it's likely that some of those are not correlated, but we would expect that some of those likely are correlated.
And Tim, just to reiterate about the isolation in that wing that you're putting the people in, is that self-contained, like so that is that something that shares? I think it was just the hallways. Could you repeat that about the hallways sharing the air ducts?
Yeah, none of the rooms vent into have no systems that vent potentially into other rooms. The only systems that vent widely are those in the hallways within. Whether or not I don't know if that wing is isolated from that. I can check and find out.
But that's the goal, right? To separate
Correct.
them from the.
Exactly.
Tim, were you able to check when you banned visits?
Sorry, I haven't had time to get to those. Really, I haven't had time since 1 o'clock. We've been working on this to get to these other questions.
Yeah.
I will say again, just to reiterate what we had talked about earlier, because the timeline appears to be confusing to some people. Again, we chose February 19th as a start date for us to start tracking, but we didn't know that we had a positive case in the facility until the 29th of February. So we're on 10 days into that process of understanding that we had coronavirus within the facility. But the fact that we'd used the 19th doesn't indicate that we knew or had the ability even to know at that point.
And that person, you said in your statement, was a patient who had been transferred out on February 24th. Does that mean a resident or?
Patient and resident gets used interchangeably at this location.
Okay.
Anything else?
Yeah, there was one other thing. Oh yeah, the employees who returned to work, does that mean that they tested negative? Because there wasn't enough time for them to go through 14 days, right?
What it means is that they followed the protocols and the guidance of the Department of Health, given the level of symptoms that they were showing, and following those guidelines were allowed to come back to work. That does not necessarily mean that they were tested and tested positive, or tested negative, excuse me.
So it's really of the workers, the 3 that have tested positive, or the ones that are hospitalized and the ones that have tested positive, those are the only workers that you know
Correct.
have it because they exhibited symptoms, basically.
We had the much larger population of employees that were showing symptoms and had self-sequestered in their own homes. That number we reported today is down from 70 down to 65.
Okay.
Yep.
And I wasn't clear, you said there were 3 hospitalized or 1?
3 hospitalized, and of those 3, 1 had positively tested as positive for the coronavirus.
I see.
So how many associated with Life Care then have tested positive so far? I mean, you have the 19 who have passed, right?
I haven't done that math, so I think today on the sheet listed 20. We would add another 31 today for a total of 51.
And a lot of unknowns.
And a lot of unknowns. And as I say, we're still awaiting results on 20. I likely will not call another briefing until 1 p.m. tomorrow. If we get, I'm sure we'll get more results over the night and into tomorrow, and I'll just update you tomorrow on what that number is at that point.
Any idea on patient 0 yet? Any kind of...
We have not received any information back from the CDC on what their research has shown.
And any information from county public health officials about what you should do? Or is this something that you guys expected?
They have asked us, and it was a question today. They have asked us to not transfer patients unless they're in an acute phase of symptoms. So their word to us is that we are to keep patients on site.
Is this the county or the CDC?
Our direct information comes from King County Health.
And did they say why?
They have not indicated to us the specifics.
Would you take anyone back? I mean, it seems, but apparently people are
At this
having a hard
point, I
time
believe that
finding
that's on a case-by-case basis.
So it's possible.
There's no, I can't speak to an official policy on that.
And Tim, I'm sorry, could we clarify on the workers that came back, you said they followed the guidelines. Did that include a full 14-day quarantine?
I can't speak to exactly what those guidelines were, but they followed the recommendations of the Department of Health. Thank you.
Thanks, Tim.
Thanks, Tim.
Thanks. So that was 31.